Hello friends, welcome. In this video, we'll be discussing psychological factors in physical illness. The highest level of development in prefrontal cortex is found only in human beings. Due to that prefrontal cortex, rather developed prefrontal cortex, we as a humans can engage in high order cognitive activities such as the meditation, samadhi or dhyan. And this leads to the highest level of psychological contentment and the satisfaction. Evidence provided by the research suggests that mental activities have significant role in the overall health and illness of an individual. The illness can be psychological as well as the physical one. But usually any type of illness is manifested through the physical symptoms, behavioral symptoms. It means to say that we can only comprehend that someone is suffering from the illness only through observation of the symptoms manifested by that individual. The illness, whether it is a physical one or the psychological one, both have significant contribution of psychological factors. Physical illness and psychological setup are intricately related to each other. Physical factors can lead to psychological illness, or the psychological factors can lead to physical illness. These factors, which one? The psychological factors, contribute, interfere at pre and post illness. Means they have their significant role prior to the illness and after the illness has been cured. That is, they can initiate or aggravate the illness, and sometimes they helps in curing the illness too. Now let us discuss something about the theoretical contribution of psychological factors. The psychodynamic theory suggests that our repressed desires and unconscious conflicts leads to the certain physical diseases such as ulcers, numbness, pain in the neck, or the gastro-intestinal disorders or the illness. In other words, if we frequently repress our desires, or we have continuous flow of conflicts that may invite various kinds of illnesses, then the certain personality types with some traits are prone to migraine, severe headache, muscular weakness, heart diseases, cancer, depression, etc., etc. So it's a very funny and interesting thing. The personality type of an individual may lead to or may invite various illnesses. The specific emotional states are important contributors in development and or aggravation of physical illness such as the chest pain, shaking, vibration, heart disease, asthma, respiratory issues and other illness. So these three contribution has come from the theoretical aspects of psychological factors. This means research has been conducted and theories has been suggested, proposed that explains the role of psychological factors in physical illness. So we'll throw some light on the prominent psychological factors that have important say in the illness. Stress, mood, beliefs, anxiety, emotions, personality, clinical depression, interpersonal relationships, perceived availability of social support. The first one is the stress. Stress is known as the silent killer, and it is spreading its wing across the globe, across the ages, across the gender, means it has gripped every individual in its evil designs. The response to psychological stress negatively affects the cognitive and emotional state. So what is stress? Stress is a psychophysiological state where we experience some kind of pressure in response to some problems, challenges, or stimuli. The response to psychological stress negatively affects the cognitive and emotional states. And which I discussed in a theoretical contribution, your cognition and emotional states have important contribution in illness. If stress interferes with your cognition and emotions, certainly it have impact on the illness too. Immune system is the prime and the first target of the stress. Hence, if the immune system is compromised, certainly individual is more vulnerable to the illness. It is known to affect the health even after removal of stresses. Stress can cause hypertension, heart-related diseases, respiratory diseases, and other mobility. Stress is, again I'm telling, the silent killer, and it must be addressed with scientific knowledge and data. The second one is the mood. The positive mood is known to improve the level of antibodies. It's a very significant finding that are instrumental in fighting the invading pathogens and vice versa. People with frequent swinging of mood are at the increased risk of getting ill faster than the mood stable individuals. Remember, if you have high rate and more often mood swinging, certainly you are more vulnerable to the illness. The third one is the beliefs. Beliefs are pre-existing notions in the cognitive domain. Beliefs remain crucial components of personality and the sense of identity used to define the way others see us. How the others perceive us are certainly defined by the beliefs. The beliefs of individual about the nature of the illness and its presentation affects how they cope and deal with it. Your belief system towards your illness and how it can be presented plays a significant role in defining the illness. So beliefs are the underlying components of cognitive neuroscience that have a significant effect on the health. Means your beliefs regulate your physical health through your psychological domain. So they are very, very important one, and they play significant role because beliefs are the product of your culture, your family, your society, and your knowledge and other host of factors. The next, anxiety. Anxiety is a normal part of life. Every individual experience anxiety. But the excessive and for the long term anxiety can lead to the devastating effect on the individual's health. It increases your respiration process or the breathing rate. It increases your heart rate, thereby concentrating the flow of blood in the brain. Because when the breathing rate increases, it needs more oxygen in your brain. The oxygen is supplied by the blood. So blood gets more concentrated in the brain. And this type of response is preparation to face a situation. This is a normal response. But excessive and persistent state of anxiety, I told you, can be fatal. So this slide represents the impact of anxiety on the human health. You see, heart, your immune system, your brain, your lungs, your spleen, your stomach, your muscles, these all organs suffer excessively by virtue of the anxiety. This means anxiety is so important psychological factor that can not only initiate the physical illness. If there is a physical illness and individual suffers the anxiety, that can aggravate and can increase the recovery time. The next one is the emotions. The mind and the body frequently interact instantaneously. The emotional arousal that can be either positive or the negative one have direct and similar effect on the physical state. What does it mean? It means that if an individual is aroused by some kind of emotions that have impact on the physical state. That impact is similar one. For example, if you are happy, your impact on the physical health is similar to when you are in an angry state. However, the negative emotions are known to influence the development of cardiovascular disease. This is additional impact. The physical response to the positive and negative emotions is almost similar. When we are happy, that time also we experience the sweating, increased heart rate. When we are angry, in that situation also we experience the sweating and the increased heart rate. But when we are happy, it doesn't lead to the development of the cardiovascular diseases. Whereas when we are angry, that time, and we are frequently in the state of anger, that can lead to the onset of the cardiovascular diseases. See, this is a major difference. Diseases such as cancer are found to associate with variety of emotional symptoms, including anxiety and depression. The emotions affect healthy individuals, and that this influence is instantaneously evident even in the absence of awareness of patient. It means if a patient is not aware that their emotions are affecting his health, that time also emotions are working in the background and compromising the health. Remember, these emotions are negative one. Now you know that the role of emotions in the physical health. So this is a diagram I've shown you here. In this diagram, it has clearly mentioned that the casualties due to the emotions. Your lungs are affected, your brain is affected, stomach is affected, joints, your muscular system, your heart. So they are all the primary casualties of your negative emotions. Personality. Personality types has been found to have susceptibility to various diseases. That's a very interesting finding of psychology. People have different type of personality types. So they are classified into type A, type B, type C, type D. Individuals who are personality type A, they are found to be susceptible to or vulnerable to the heart diseases. Type B, they are found to be lethargic and slow moving. Type C, they are prone to cancer, and type D, they are prone to depression. This means the personality type is an important contributory psychological factor in illness. Next one, the clinical depression. Why it is named as a clinical depression? Means depression that have clinical connotation. The clinical depression correlates, negatively with immune system, sometimes due to behavioral factors such as the poor sleep, less exercise, poor diet, smoking, use of alcohol and other drugs. These are some behavioral factors that leads to the illness through compromising the immune system. Why? Because when an individual is in depressed state, in that case, that individual is prone to falling on these behavioral factors. That is, depressed individual likely to have poor sleep. They have poor diet. They are more prone to drug abuse. That lead to the different of illness. The depression leads to increased risk of condition like stroke, that is the brain stroke, diabetes and rheumatoid arthritis. It has a significant contribution. Then comes the interpersonal relations. The belonging to a strong social network is associated with longevity. This is a very interesting point I want to make here. If you are associated with a network that is socially strong and you are frequently contributing in the social causes, certainly you will have a better quality of life and longevity. That is the indirect or the bonus benefit of engaging in the social activities. The loneliness, separation and disclosure of traumatic events have negative effect on the immunity. See, if your interpersonal relations are not okay, certainly they may compromise your immune system. And once your immune system is compromised, your vulnerability to the illness increases. Because poor interpersonal relations cause psychological distress and which have negative effect on your physical health. Perceived availability of social support. What's that? This psychological factor is important aspect of individual's temperament. Why the word temperament has included here? Because temperament decides how you perceive the availability of social support in your vicinity. That means how much you are expecting from the society when you feel some kind of a problem. So if you perceive that there is a lot of people around me who can provide me help in the distress or in some type of problem, certainly you will have a better health. And individual with social orientation tends to have optimistic attitude towards social support. It has also been associated with immune function. See again the role of immune system. If you perceive that social support is sufficient for you to meet the challenges, certainly you will have better and enhanced immune system. And once your immune system is improved one, certainly your vulnerability to illness decreases. And how you perceive others' role in your life, also important contributor in your physical illness. One more important factor here, the perceptions of available support, that is social support, protects person from the pathogenic effect of stressful events. This means if you perceive that social support is always available for you when in need, certainly you will experience or we will experience less stressful events. And if we experience less stress, certainly we will have a better health and vice versa. So at the end, we'll discuss something, the psychological factors and immunity model in a just like a diagram. You can understand the maximum psychological factors have direct or indirect impact on the immune system. And immune system is a wall, protective wall against the aggressors or the pathogens. In this model, you can study the psychological characteristics or the state. From that, it's accrues the CNS, central nervous system innervation, hormonal response, and behavioral changes. Means your psychological characteristics directly influences these three: CNS, central nervous system, hormones, and behavior. This comprehensively impact your immune system and changes the immune system. That leads to the disease susceptibility. If psychological factors are not taken care of, certainly they can lead to the, rather they not only lead to the onset of the illness, it can aggravate and lead to the fatality. Okay, friends, I have added a new feature in my discussions or the videos. I'll discuss some 5 or 6 multiple choice questions what we have discussed till now. I'm not going to share the answers with you. You have to find out the answers, but I will give you the options. So first multiple choice question is, the higher order cognitive activity such as meditation is regulated by the which lobe of human brain? So you have to select out of these 4 options: frontal lobe, temporal lobe, occipital lobe, or the parietal lobe. The second question is, which of the following psychological concepts contribute in physical health and illness? Options are interpersonal relations, social support, emotional state, all of the above. I know you are smiling because you know the answer. And the third question is, stress has strongest negative impact upon which of the following body systems? So these are the options: skeletal system, circulatory system, excretory system, and immune system. I know you have seen the video carefully, that's why you can very well answer this question. The next question is, which among the following is not a psychological factor that have role in physical illness? So these are the options: personality, hormones, mood, and anxiety. And the next question is, the repressed anger can lead to which of the following physical illness? The options are chronic back pain, heart disease, high blood pressure, and all of the above. The last question is, anxiety leads to which of the following changes in internal body functioning? The options are high blood flow to the brain, repressed hormonal secretion, decreased function of respiratory system, and the last option is the increased blood flow in the bowel area. So with this feature, you can revise what you have watched in the video. Okay, dear friends, these are my references. You can read for further insight and you can cross check whether the contents which are discussed in this video are appropriate or there are some issues. Okay, the next discussion will be lifestyle and health. Okay, dear friends, if you like this video or the contents of this video, share with others. If you have some issues, just drop a comment in my comment box, or you can drop an email at vamasujit@yahoo.com. Thanks for watching.